based on the very exciting response rates and good tolerability of anti-PD1 antibodies in the relapsed setting, they are increasingly investigated in the first-line setting. And this is either done sequentially or concomitantly in combination with chemotherapeutic backbones. And both these strategies yield very high overall and complete response rates and incredibly high progression-free survival rates of usually 98 to 100%. So most of these patients don't relapse or progress with this treatment. And this begs the question whether all of these patients actually need the combination of an anti-PD1 antibody and a full course chemotherapy, or whether we are able to reduce the exposure to conventional chemotherapy and radiotherapy in this setting. And to move this forward, I think it's important to individualize these immunotherapeutic approaches by ideally having a baseline risk stratification that could be circulating tumor DNA load, or this could also be the metabolic tumor volume at baseline, and then have on-treatment biomarkers that tell us whether a patient has a striking early response to anti-PD1 blockade, usually administered as a single agent, and then later on does require less or even no chemotherapy, or if this is a patient that is at high risk of disease progression or relapse, and then requires the addition of chemotherapy or radiotherapy. And by individualizing this immunotherapeutic approaches in the first-line setting, we will likely be very able to reduce the overall burden of these cytotoxic agents, and thereby optimally benefit the chance of being cured with the risk of late or early side effects. And this is a very exciting time, I think, for Hodgkin lymphoma research and also for our patients, because we can move away from these conventional agents while maintaining our high cure rates. What remains a challenge is the baseline risk stratification and also the on-treatment response assessment. And I think the two main tools that we should use for this is the circulating tumor DNA, as I said before, and also the metabolic tumor volume, because these two measures nicely correlate with each other and also have been shown to be of high predictive or prognostic relevance in the treatment of Hodgkin lymphoma.